everyone, this is Marika and I welcome you all to this new session of nursing management. In our previous sessions, we have discussed about hospitals, the different objectives and scope of the hospital, and we also discussed about the organization and function of the hospital. In the very last session, we discussed about the classification of hospital, and in this session today, we are going to discuss a very important topic, which is ward management. So far, we have understood what is a hospital, and we have also seen that there are different types of hospital, and every hospital, in order to provide a proper care to the patient, has different wards. Having a ward within the hospital is a way of managing the hospital services, the delivery of the care to the patient. Different wards have different kind of patients, therefore the wards are segregated in such a manner so that the patient with specific health needs can be provided care at a specific ward. Now, as we have the segregated ward, the management of the ward is one of the most important thing, and it has to be managed in a proper way for the delivery of the services. Now, we have already understood that wards are the local units within the hospital. In a hospital as an organization, there are different wards. Therefore, we can say that wards are the local units of the hospital, and ward management is very important. Once we have a proper ward management, it helps us to manage the entire hospital as an organization properly. So we are also aware that there are different wards within the hospital, and each ward is headed by a head nurse. There will be a head nurse who will head or who will supervise the entire ward. It is the responsibility of the head nurse to manage the wards, to see that there are no problems, no conflicts within the ward, and the environment within the ward is peaceful because it reflects the quality of care provided within the hospital. Who will be considered as the head nurse? The nursing superintendent, who is just below the chief medical officer, is responsible for allocating the head nurse. So who appoints the head nurse? It is the nursing superintendent who appoints the head nurse for each of the ward. Moving on, let us see the organization of ward management. For the organization of ward management, the person who is responsible to look after the ward, as we have discussed, is the head nurse. So it is the responsibility of the head nurse to ensure that the environment within the ward is peaceful, the work is carried out properly by all the staffs within the ward, and the care that is being provided to the patient is of good quality. Under the head nurses, we have the staff nurses, senior staff nurses, as well as junior staff nurses. Under the staff nurses, we have the student nurses, we have the attendants, we have the sweepers, and the ward boys. Let us now see what are the responsibilities of a head nurse. We are already aware that a ward head nurse is the one who heads the entire ward, who looks after the entire ward. But what are her actual responsibilities? What are the tasks that a head nurse must carry out? The very first task is to plan a duty roster. So within a ward, there will be several patients that will be admitted, and also there will be many nurses working in different shifts to provide care to the patient. So it is the responsibility of the head nurse to plan a duty roster for the entire ward. From all the staffs working within the ward, the head nurse also chooses one of the staff nurses as a ward in charge. The next responsibility of a head nurse is to coordinate and control the activities within the specific ward. So each head nurse has their own ward, and therefore they have to control and coordinate the work going on within the ward. Another responsibility of the head nurse is also to plan all the activities that will be carried out by the ward in charge. The head nurse not only plans the activities to be carried out by the ward in charge, but she is also responsible for delegating the work to all the employees working within the ward, and also to ensure that the work is being carried out effectively. Another responsibility that we are going to discuss is one of the most important responsibility of the head nurse. So the head nurse must also supervise the nursing care, the quality of nursing care that is being rendered to the patients admitted in the hospital, and a timely update from the patient. And also has to take a timely update about the quality of care that is being rendered to the patients. Another important function of the head nurse is also to conduct nursing rounds in the hospital. So the head nurse is responsible for conducting nursing rounds, and we are already aware why nursing rounds are conducted. Nursing rounds are conducted by the head nurses to see how effective the nursing care that is being rendered to the patient is. What are the problems that are being faced within the ward by the staffs as well as by the patient? To clarify those kind of problems, to resolve those kind of problems, to plan effective care and to fulfill the requirement, and also to guide the ward in charges. Another important function of the head nurse is to maintain the enrollment register for all the staffs and to ensure that the staffs are reporting to their duty on time. The next responsibility that we are going to discuss is one of the most important responsibilities, especially in a hospital. So nurses who are providing care to the patient may take leave. They may be absent for a period of time. Therefore, in such cases, when the allotted nurses are absent for a period of time, when they take leave, it is the responsibility of the head nurse to make sure that those responsibilities are handed over to another nurse during the time of absenteeism. Another important function of the head nurse is to conduct the meeting with the subordinates. So within the ward, when the nurses are providing care to the patient, they may face various problems. Not just facing problems, they may have requirements of different articles, equipments. Some of the equipments and machineries may not be functioning. There can be so many problems that a staff might want to report to the head nurses. Therefore, the head nurse must conduct a meeting with the subordinate staff in order to make sure that their problems are addressed and also they are provided with proper guidance and teaching that is required for them. The next function of the head nurse is not just to look after the work that has been given or assigned to the staff nurses, but also to make sure that class 4 workers such as sweepers, attendants, ward boy also are carrying out their responsibilities effectively. And finally, the last responsibility of the head nurse is to frequently supervise the entire ward to see any kind of problems that are being faced in the ward and also to maintain the cleanliness within the ward. I hope you've understood what is the function of the head nurse who heads the entire ward. Now, under the head nurse, we have ward in charge. Let us now discuss the responsibilities of ward in charges. The ward in charges are the person who will be responsible for all the activities carried out within the ward. The very first thing that a ward in charge must do is to report to the head nurse. Reporting to the head nurse for any kind of issue. So here we have to understand that the ward in charge is always present within the ward, supervising the ward and also working in the ward. But when we think about the head nurse comes to the ward, conducts the round and goes. It is the ward in charge who is more aware about the problems, the activities, the responsibilities within the ward. Therefore, she is the best person to report about the issues to the head nurse. Another important responsibility of the ward in charge is to plan, control and supervise the activities of all the staffs within the hospital. She also has to ensure that the required area are provided with enough number of staffs, equipments and articles. The next responsibility of the ward in charge is to ensure the cleanliness of the ward. The next responsibility of the ward in charge is to check the patient's condition regularly and if any problems are identified to report those concerns to the doctor who is taking care of the patient. Another responsibility of the ward nurses is also to conduct the rounds within the hospital, to coordinate the day and night shift of the staff nurses working within the hospital. And finally, the last responsibility of the ward in charge is to meet the health needs of each and every patient admitted within the hospital. Let us now see the responsibilities of senior staff nurses. Senior nurses work under the ward in charges. The senior nurses are expected to report to the hospital to their duty on time and also sign in their register. Senior nurses are the most important people working within the ward because they are responsible for providing individualized care to sick people, and they are assisted by junior nurses. So senior nurses are the people who are providing direct care to the people who are seriously ill. Senior nurses are always assisted by juniors or fresher nurses. The senior nurses, as they are responsible for providing the care to the patient directly, they are the person who report about the patient's health or the progress in the patient's health to the ward in charges regularly. Another responsibility of a senior nurse is to record the patient's details and data in the nurse's record. So it is the senior nurses who keeps the patient's record. The senior nurses also have the responsibility of maintaining the care sheet of the patient, which includes the identification data, the diagnosis data, as well as the doctor's sheet. The senior nurses also look after the work that is carried out by class 4 workers such as sweepers and attendant, and the senior nurses are the people who help the student nurses learn and practice nursing care. Senior nurses also look after the cleanliness of the unit. They keep the unit clean and tidy. They look after the requirements of the ward related to the linens, the articles and equipments that are required within the hospital. The senior nurses also identify the supplies that are required within the hospital, and with the approval of ward in charge, they order the supplies required in the ward. And finally, the last responsibility of senior nurses is to allocate the work to junior nurses as well as to staff nurses. So these are the responsibilities of senior staff nurse. To conclude today in this session, we have discussed in detail about the responsibilities that are carried out by the head nurse, by the nursing in charge, and also by the senior staff nurses. In our next session, we are going to discuss about the factors affecting ward management and also issues in hospital management. I hope the class was helpful, and I'll see you all in the next session. Thank you and have a great day ahead.